In this video, we're going to be talking about how Crohn's disease and ulcerative colitis increase your risk of stroke and what you need to be doing right now if you have one of those two conditions. So Crohn's disease and ulcerative colitis are inflammatory bowel diseases, and that's what I want you to remember. Inflammatory, inflammation, that's the connection, I think, between those two conditions and stroke. So Crohn's disease and ulcerative colitis are essentially autoimmune conditions. How do you find out if you got those? Well, there's a lot of different symptoms, and I won't go into those because if you're watching this video, you probably know you have Crohn's disease or ulcerative colitis. But what you might not know is that those are actually autoimmune conditions. And some of the antibodies that are present in those conditions can lead to problems with your blood vessels and thus can lead to stroke. Now, this study was done on over 85,000 inflammatory bowel disease patients in Sweden, and they did like a little sibling match study. So it's actually a really, really nice, powerful study. And essentially what they found is that if you have ulcerative colitis or irritable bowel syndrome, your risk of stroke increases, and it elevates and stays increased for up to 25 years. Okay, so it's not just like a 1 or 2 months, it's elevated for years. And the translation is that it increases your risk of stroke and you're more likely to get a stroke, particularly an ischemic stroke. Now, an ischemic stroke is a little bit different from a hemorrhagic stroke. Hemorrhagic stroke is where a blood vessel bursts and the blood blocks other blood from getting to the brain tissue. In an ischemic stroke, you can have things like a clot, some sort of a clot break off and then get lodged in a blood vessel and deprive your brain of blood that way. So the reason I'm giving you this video is it is time to be proactive. If you have Crohn's disease, if you have ulcerative colitis, you need to start doing something to get your immune system under control. Now, I've seen a lot of these types of patients over the last 20 years, and there are things that work for just about every one of them, with a lot of exceptions, because every person that has Crohn's, every person that has ulcerative colitis, they're unique. And one of the very important things that we have to do with someone like that is find out what their immunophenotype is, meaning what is their immune system fingerprint? What is their immune system doing? Because if you give me 10 people with ulcerative colitis, 10 people with Crohn's, yeah, they all have inflammatory bowel disease, but what their individual immune systems are actually doing differs from person to person, right? It's just as unique as your fingerprint. So that becomes very important in finding out what you're going to do to manage that immune system and regulate it. Are there diet things you can do? Absolutely. Well, I'm not going to go into those now because I don't really want you trying to DIY those on yourself, because you need to be working with someone that understands how these conditions are connected to stroke risk. One of the things that can be connected, I alluded to earlier, were these antibodies. So you can get these things called ASCA, ASCA, and ANCA, ANCA antibodies. ASCA stands for anti-Saccharomyces cerevisiae antibodies. And if you don't know what that is, Saccharomyces cerevisiae is baker's yeast. ANCA, the ANCA, that stands for anti-neutrophil cytoplasmic antibodies. Now, those you can find not only in Crohn's disease and ulcerative colitis, but you can also find it in what we call vasculitis or vasculitides, however you want to pronounce it, which are blood vessel inflammation conditions. And without going too deep down the rabbit hole, all you really need to know is that Crohn's disease and Crohn's disease and ulcerative colitis are inflammatory bowel disease, and that chronic inflammation creates a cascade of problems that increases your risk of clotting, increases your risk of atherosclerosis, increases your risk of stroke. And you need to start doing something now and find a doctor who understands that and start being proactive. Don't be reactive. Don't wait till you have the stroke and then you have to come see me or someone like me for the stroke rehab. Let's prevent the stroke. I'm going to put the paper link down here in the bottom. It's a pretty recent paper. I got to admit, I wasn't scared by it because I knew what the connection was, but just how much it increases your risk, I wasn't ready for that. It increases your risk for 25 years after diagnosis. So don't delay. You got to start working with someone now.